Hello, everyone. My name is Felicitas Simpachikamfipa. I'm a Chief Reproductive Health Officer working with the Malawi government in the Ministry of Health and Sanitation. Today, my leadership project is on sexual and reproductive health access and rights of young people with physical disabilities. Young people are a special group of people who are transitioning from childhood to adulthood. And during this transition process and period, there are a lot of changes that occur, including physical changes, psychological changes, as well as social changes. And with these changes come also the changes in terms of behaviors. And sexual and reproductive health behaviors are one of those that would observe. And for those young people with physical disabilities, the challenges are compounded, sometimes due to the social stigma that is out there, that they're being considered as asexual beings and hence not required to go and access the services on sexual and reproductive health. And sometimes it's due to the inaccessible infrastructure that is in the remote areas, hard to reach areas, and infrastructure built in a way that cannot be accessed with some of the people with physical disabilities. And also sometimes it might be due to the lack of capacity by the health workers to be able to interface and interact with the young people living with physical disabilities. So basically this leadership project was looking at the health system and seeing to it how best can we be able to improve it to have inclusivity in the way we're delivering the services that the young people with physical disabilities can also be able to achieve their full potential in terms of health and well-being. And through this leadership project, I have been able to start implementation by first of all signing a project charter with GIZ Malawi, where they're providing financial support and technical support, and I'm the lead implementer with the technical expertise. And together we managed to map 2 districts in terms of the availability of the young people living with disabilities. How many are they? Where are they found? What needs do they have? How can we come in? And this mapping was done in one rural setup and in another urban setup. And we also started the development of key messages on sexual and reproductive health, trying to create demand. And these messages are being developed in the format that they can be able to access and fit for them, like, for instance, in Braille, as well as in sign language. And this leadership journey has really helped me to reflect on a lot of things, including my authenticity as how I've seen myself as a leader, what grounds me. And for me, it's making a difference in others. And in the space that I am in the session reproductive for young people, I would like to make a difference in those who are vulnerable, who are marginalized, like the ones living with disabilities. And inclusively, as a leader, the leadership project has given me a voice to be able to sit in a room and raise up a hand and speak up and advocate and try to connect and find the ones whom we share we share similar values. And that is how I managed to find GIZ. And as an impactful leader, it has also made me realize on what difference we can bring in terms of the spaces we're occupying. So I am in the policy space, and I've tried to look at the policies that we have. The sexual and reproductive health policy in Malawi, it has very good points where it is highlighted on disability inclusion, but on the ground, less is being done. So for me, I'd like to translate that into practice. And strategically, I'm generating evidence, I'm generating data that can be used in the future for others in terms of advocacy as well as looking for funding. Moving forward, I'd like to work more with organizations or for people with disabilities, making sure that they are stronger advocates, and also working with the grassroots implementers where the change should begin. And strategically, I would want to include more activities on disability inclusion in sexual and reproductive health for young people in our national budgets so that gets funding from government. And For impactfulness, I would also want to include a disability and adolescence module in the Youth-Friendly Health Service manual that is currently under review, so that the health workers should be exposed to these topics and we should be able to discuss issues around them. So thank you so much for having me, and thank you for listening to my presentation.